Morning, everyone. Um, Welcome to the sixth year of the survivorship lecture series. So this is an exciting morning and doing something a little bit different. We focused a lot on cancer survivors in the past few years, but today it's a little bit more on prevention. We have Gargee Patel, who's the Associate Director of Community Partnerships at the American Cancer Society, where she has spent the past 6 years leading strategic collaborations with community organizations, health systems, and FQHCs to expand access across the cancer continuum. She holds a Master of Public Health in Epidemiology from the University of Florida and an MBA in Healthcare Management from Quinnipiac. I always pronounce that wrong. Quinnipiac University. Gargie's commitment to her work is deeply personal, having served as a caregiver for both her mother and sister during their cancer journeys. This personal connection fuels her commitment to the ACS's mission and her drive to expand access, reduce barriers, and support the communities who have been touched by cancer. Today, she will be talking to us about the Voices study about cancer prevention in Black women. So, Gargi, tell us all about this study.
Thank you all so much, and good morning. I'm excited to be here with you all to be able to speak and share a little bit more about our new study that we've launched. Before we kickstart into what is the study, I wanted to just do a quick brief overview for ACS and our mission. So we understand that right now the burden of cancer is extremely high. Recently, we did release our 2026 Cancer Facts and Figures statistics, where new findings show, as I know this is a group focused on cancer survivorship as well, the 5 year survival rate for all cancers combined reached 70% for people diagnosed between 2015 to 2021, which is amazing news and a great breakthrough. We've seen that survival gains since the mid 1990s have especially been notable for even the most fatal cancers. So that includes myeloma, where the survivorship went up from 32% to 62%, liver cancer, which went from 7% to 22%, and then lung cancer, which is 15% to 28%. All the while, we know that the burden still exists. In 2026, there is an approximately 2.1 million new cancer cases that are still expected to be diagnosed and projected to occur. That would be about 5,800 new cases each day. So we understand that that burden is still completely and unacceptably very high. And so because of that, that really drives our mission and vision. Our vision is to be able to end cancer as we know it for anyone. So this includes anyone that has been touched by cancer, whether it's a survivor, a caregiver, healthcare provider, someone who's recently been diagnosed. We know that cancer can touch anybody in even the slightest ways. So our mission is really to be able to improve the lives of people who have been touched by cancers, support families through our work in advocacy, our work in discovery and research, and patient support to make sure that everyone has that equal opportunity to be able to prevent, treat, detect, and survive cancer. In order for us to help really achieve our mission and reach our vision of being able to end cancer as we know it for everybody, we use a three-pronged approach to be able to improve the lives of those who are diagnosed with cancers and, of course, families. This is through our research, advocacy, and patient support that I mentioned from our vision, or sorry, our mission statement. Our discovery team is the key component of our research aspect. They focus on research breakthroughs that will be occurring around the cancer prevention, detection, treatment, and survivorship space. We've had recruited so far over 2.5 million number of volunteer participants. Really, we also have launched some of the world's largest population studies and cancer prevention studies of cancer. Advocacy, we have advocacy presence at every level of government across all 50 states. So that includes really being able to focus on amplifying legislative efforts that can help improve the quality of lives for those who are diagnosed, be able to support accessibility to screening and early detection through legislation, tobacco cessation, and really being supporting and being that voice for by really advocating for patient advocacy. And then lastly, we have our patient support team, which really is the team that I focus on and I work on. So we work on direct patient support by focusing on prevention efforts, screening, navigation, addressing lodging, transportation, barriers and care, survivorship, and education. We have patient support teams across all of the US, and we've been able to touch more than 55 million lives per year through the work that we do in order to achieve our mission. With that being said, in addition to funding research, ACS is also a leading research institution. So, the American Cancer Society in the past has conducted some of the world's largest population cohort studies for the past 70 years in really to be able to understand how cancer might develop in a population and how to be able to improve the quality of cancer of life after diagnosis. So, when participants join these population cohort studies, we obtain consent from them and then they essentially provide consent to be able to provide us information over a course of period of time. And in that time frame, we also are able to see what changes are those research participants experiencing across their lifetime. That long-term data that we compile will allow us to be able to understand what factors are contributing to a potential cancer diagnosis. It will help us identify different risk factors and really learn about how to improve these factors that are driving disparities to improve survivorship and even overall general health outcomes for the individual. As you see on this slide, we've previously launched our CPS-1 phase 1 study, which is the cancer prevention study, where we were able to recruit over 1 million participants, CPS-2, and then CPS-3, which is 2006 to present. Knowing that there is still so much work to be done in the cancer research space, in 2024, we recently expanded our focus of population cohort studies by officially launching the new Voices of Black Women study. So ACS has truly committed to being the center of experience for Black women since the study design and implementation phase of Voices. On this slide, you see listed here are two co-PIs, Dr. Lauren Makala and then Dr. Alpha Patel. The design of the Voices study was informed by many years of formative research consultations, focus group discussions that were happening, consultations with scientific leaders who have that expertise and in different aspects of a Black woman's health. Information from the focus group that we also had conducted was used overall to drive the study design, the review piece of it, and the revision of the data collection tools. The Voices Scientific Advisory Board also comprised of leading Black women scientists who had been engaged to really help drive informed decision making about how does the study design look, being able to review the study recruitment materials, the data collection tools, and really advise on the overall study implementation. We have a community engagement piece around this study, which is being able to recruit Voices ambassadors. Ambassadors are trained community advocates. They receive training from ACS. They also are provided some resources and materials to feel equipped and confident to go out into the community, advocate for the study, and really drive our recruitment efforts. We also work from a national and local partnership level. This could be Black civic, faith-based organizations, health system partnerships, community partnerships, corporate partnerships, and just overall our local and national partnerships that's going to support our recruitment efforts. When we work with our Voices ambassadors, there's ongoing communication with them. So we're able to collect feedback and even best practices for recruitment and being able to better strategize around any challenges that are being faced to support the recruitment efforts for this study. So I'm sure you all are wondering, what is the study and what will it entail for participants? But of course, before we deep dive into that, I wanted to talk a little bit about some of the health disparities that we all know are being faced amongst Black Americans. Voices of Black Women is actually a natural extension of the legacy of the cohort research that we've previously conducted at ACS. So, of course, as we know, there's a lot of growing health disparities that are being faced between Black and white Americans. This is both in the areas of cancer incidence and cancer mortality, but also, as you see on this slide, for other health conditions. So, really being able to conduct a large scale cohort for Black Americans would have substantial value, even across just looking at cancer. We see here that in 2016, the death rate in the US was much higher for Black than white individuals for some of the chronic conditions you see listed below. Of course, this has shared etiology and even more profound impacts on survivorship of cancer. So their death rate was extremely high in comparison for heart disease, stroke, influenza, pneumonia, diabetes, hypertension, kidney disease, HIV, AIDS. And collectively, we know through the data that we've gathered that Black individuals also tend to have the highest death rate and even the shortest survival rate for in comparison to any racial and any ethnic group in the US for most cancers. So knowing some of these disparities, we really wanted to be able to understand and have researchers understand what factors are contributing to these disparities so that we're able to in turn find the right interventions and solutions to implement to eliminate some of these disparities. We know that there's a lot of health disparities that exist. Understanding them is always the first step to be able to facilitate our understanding of how we can navigate them. So, what's driving some of the disparities in this population? We know that individual and systemic racism is a key component of it. Biology, lifestyle, behavioral factors, environmental factors such as air and water quality, having accessibility to proper transportation, housing, overall community safety, accessibility again to healthy food sources as well, and spaces to ensure that you have the opportunity to be physically active. Behavioral factors such as tobacco use, diet, excess body weight, physical inactivity, social factors, clinical factors such as making sure that the individual has access to healthcare, but also quality of healthcare is they're being provided high quality. And then psychological factors, stress, mental health, and then other comorbid medical conditions and the type of insurance that the individual might have. So, the voices of Black women, the main goal of this is to really be able to understand why do Black women at one point get cancer and then potentially pass away from cancer. Understanding this can really help inform our strategies to be able to improve cancer prevention, improve treatment, and survivorship, amongst other health outcomes for this population that we want to focus on due to the various health disparities we know that this population faces. Our Voices of Black Women study officially launched on May 6, 2024, and our goal is to enroll 100,000 Black women. Of course, if we were to exceed that, that would be even better to have more patient population to be able to study and follow and track. We'll also be enrolling Black women that are between the ages of 25 to 55. And as you see on this slide, the goal is to make sure that we're focusing on individuals who have never been diagnosed with cancer, with the exception of potentially having a diagnosis of basal or squamous skin cancer. And then last but not least, we ask that they reside in the United States, but recruitment is now occurring across all 50 states, which will help amplify and make sure that we're really reaching the right individuals to enroll in the study. So let's take a quick look at what does a Voices enrollment look like. If an individual is interested in enrolling in the Voices campaign or the Voices study, they first have to fill out an eligibility survey. So that will take less than 5 minutes, and it really just makes sure that the participant meets the overall criteria that we just talked about to be able to join Voices. And then the next form that they fill out is the informed consent form. So that should take about 10 to 20 minutes where they read through the papers and ensure that they understand what the study participation will entail and what they're giving consent to. The last piece is going to be the registration survey. So that takes about 10 to 15 minutes for the participant. And that really just makes sure that our Voices study team can follow up with the participants at a certain course of time. The bulk of the study that we're looking at will be for the individual to fill out the life and health history survey. So this survey will take about 60 to 90 minutes. And then the next slide will go over what will that entail. And then this basically is data that's collected across different broad range of topics. And that is going to be followed twice a year for follow-up, which is only just 1 hour of a year that can make a lifetime of a difference for generations of Black women to come. In those two annual follow-up surveys, we're basically checking in via email to have them update that survey to ensure that we're capturing the latest data over a certain period of time. So let's take a quick look at what is the content of the life and health history survey, because this is going, like I said, the bulk of the data that we're going to be collecting to really understand disparities. And this is going to be monitored over even a period of up to 30 years to see if there's any changes that's driving some of these disparities, if and should a woman be potentially diagnosed with cancer in that time period that they're being followed. So the standard content in the health study will, of course, be to look at their overall demographics, their ancestry, any accessibility to insurance, if they have insurance, what type of insurance that they might have, overall general healthcare, cancer screenings, not just if they're up to date, but which screenings have they gotten done, what underlying medical conditions do they have, are there any medications that they're taking, are there any vitamins and supplements that they're taking, what does their family history look like, what is their overall status for reproductive health, and even their occupation. Occupation does go hand in hand with environmental factors, maybe potentially being exposed to specific pollution or other substances. So making sure we're collecting all the data in the most detailed capacity will be important, which is why you all saw that this survey could take potentially 60 to 90 minutes, making sure that individuals have access to this information so that it's as accurate as possible. The next piece of history that we'll be covering in the survey is behavior and lifestyle information. So, of course, it's important to understand, what is the alcohol intake like, if there is any, what is their tobacco smoking status, if there is any, what does diet look like? What does diet environment look like? Do they have accessibility to healthy eating, healthy food choices as well? Physical activity, overall built environment, what does their sleep levels look like, any fatigue, anthropometrics, personal care product use. We know that there are some personal care product use with ingredients that might be carcinogenic, so making sure that we're really checking in on the key details of every day-to-day life that an individual is using or really participating in on a daily basis. Mental and emotional health stress. So, of course, these questions ask about the experiences of Black women as they relate to their health. So, mental health, what's their quality of life look like? What's their overall stress level? Are they caregiving at all? Is there any racism or discrimination that they feel that they face? What's their education level? Overall socioeconomic status through income, generational wealth, social support, and even social interactions. So, all of this information will be collected, and then twice a year, there will be a check in with that survey to make sure that it's up to date. So, how can you get involved? Of course, if eligible, joining today to become part of the 100,000 Voices of Black Women would be key. Being able to take a moment to share the Voices website with up to 3 people you know, share it with anyone in your network, any loved ones that you think might really benefit. Of course, it's a low lift in a sense of it's one time fill out of a 60 to 90-minute survey, but then it's only twice a year of a follow up over a course of time to be able to just check in and see if there's any changes in their health status. Amplifying voices through your personal professional network, and then also just learning more about Voices of Black Women at our website that's listed here, which is voices.cancer.org, or scanning the QR code to get access directly to the link. I know we recently have a new partnership going with Mile Square, which we're so thankful for to be able to work with the team to strategize how can we disseminate and get this study out there to the patient population of Mile Square to be able to really recruit individuals who are eligible and really just be able to share it with your network. So we're really appreciative of that. I know the next slide is just to take questions, so I'm happy to take questions. We were supposed to have an individual from our study team, but unfortunately there was a conflict. So I'll do my best to answer any questions, and if I can't, then I will definitely take it back to the study team and make sure that Dr. Mance, I reach out to you with the most appropriate answer to share with your team. But thank you all so much for your time and listening.
Thank you, Gargee. This sounds like a phenomenal study. I know we had several people join up late, so um, just to recap a little bit, I mean, you went over a lot of statistics, and it's still, like you say, so staggering that there are so many new cases of cancer. It's great we're making such progress in those areas and certain types of cancer. But yeah, this is a frequently underrepresented community, so I like the focus. And maybe I missed it. Remind me, is this for women across the country, right?
Yep, it's
So
available in all 50 states. So we're looking at recruiting, as long as they're residents of the US, then they would be eligible.
great, because we have multiple people who have joined up from other states.
Okay.
Um, because I'm sorry, guys, for the late posts on the Cancer Survivorship Provider Network. We can post on there as well. What are you doing? I mean, you said you're working with Miles Square. Um, and are you working with other clinics at UIC as well to get push this information out to patients?
Yeah, so recently our partnership with Mile Square, I'm not sure if my colleague Karen Scherer is on yet. I know she mentioned she was going to join, but she is the relationship staff partner for UIC, and so we actually have discussed being able to include some of the key contacts from the Cancer Center to also be a
Yeah.
part of the conversation with Mile Square.
Yeah, Karen,
Yeah,
tell us how you're working with the community at UIC.
yes, I'm here and so sorry for my voice. I'm dealing with a cold. Um,
Okay.
but yeah, so we launched Voices back in 2024. And of course, with UIC and the UI Cancer Center being a key partner, there was a few events in which Voices was promoted. I know there were a couple survivorship events. We were able to share flyers and speak to some of the women. But coming up in 2026, we're looking for new opportunities to be able to reach the eligible population. So, as Gargee said, Black women between the ages of 25 and 55 who've never been diagnosed with cancer. And so, if you yourself, you have access to that population and you're willing to share information to patients about that or to community organizations, we'd love to understand how we can even partner even further in 2026 to spread the word about this study. So I don't know if Gargi had a chance to mention this yet, and sorry, I had to join a little bit late, but we're looking to enroll 100,000 Black women into this study. Right now, where we are is I think we're a little bit over 5,500 individuals, and this is nationwide. So we're quite a ways from where we need to be in terms of enrollment. I know in Illinois itself, we were looking at targeting maybe about 4,000 Illinoisan women to enroll in the study. And right now we're at about 242. So we're trying to just really reach out to our partners, pound the pavement, anyone who's willing to help us spread the message of why it's important to enroll in this study. And then also have the message come from trusted individuals within the community is really important. And we know that UIC, you're a mainstay within the community. A lot of people trust their physicians. They trust the individuals that they come across. And so wherever you can help, let us know. And me and Gargi would love to have that conversation.
That's great. Yeah. Karen, we're all willing to help spread the word on this. Everyone on this call, I'm sure anyone who interacts, I interact with African American women. Um, Tamara is asking, is there an incentive for these patients to be involved in this study?
No, there won't be any incentive provided for participants.
Okay. And Kristen Beck from, I think you're from Memorial Sloan Kettering or something, Kristen, right? Do you have any canned meetings messaging that we can use that, like a flyer or something, so that we can link on our LinkedIn and social media and things like that?
Yeah, we definitely do. We have a flyer that's focused for survivors. We know that survivors are a key component to be able to empowering their community on their behalf to be able to join this study. We also have a flyer that's focused on just general recruitment, not focused on from a survivorship standpoint. So we have different flyers that I can send to you, Dr. Mance, at the end.
Great.
Um,
Perfect. Yeah.
yeah,
Betty
Karen.
with Teen Cancer America says send us a marketing, a comms toolkit so that we can help out with spreading the word on this.
Yeah, perfect. Thank you so much. Karen, do you know if we have social media toolkit specifically for like LinkedIn?
That's a really good question. So if you go to our Voices, cancer.org page, which is the same website in which you sign up for the study, there's actually a link, and we can put it within the chat, where it says, hey, if you want to help us spread the word about the study, there's a flyer and a recruitment card there that you're able to get access to. if you're looking for something more specific and more robust, we do have that available. So that's where if you want to send email templates, we have web banners, we have, just a lot more comprehensive. If you would like to help promote the study, I
Hmm.
can work with you to get that information over to you. And then also, if you would like to sign up to be what's called a Voices Ambassador, where you are really you're a trusted individual within the community. But to become an ambassador, there's like a little short online training for you to be able to really be able to learn about the study so you can talk about it appropriately, right? When you're going out to audiences. And then from there, you get a whole toolkit of, communications and the emails, the flyers, and all of that. And you're enrolled within that. So I think it depends on what you're thinking, like the level of how
Yeah.
you want to be involved. But if you want to drop your information in the chat, Team Cancer, we can follow up via email and see what would be most helpful to get over to you.
Well, Betty, what do you have to say? You're chomping at the bit always.
Yeah, I'm so glad I hopped on.
I'm
And
glad
Karen,
to.
hello. I haven't seen you in a while. It's Betty from Chicago. Um, this is fabulous. Oh my gosh. When I logged on, you were going through, and I did a screenshot of the survey. We, as human beings, need this information.
Mhm.
We need validation of what is causing cancer.
Mhm.
Not enough money and effort is put into that. And that is probably not your goal here, but that's what you're going to be discovering. I mean,
Yeah.
what you are asking of the people who participate is vital to understanding the toxic environments we
Mhm.
live in. So thank you for this. I have a couple of people, this is outside the cancer silo, right? We are all in the cancer silo. So we got
Yeah.
to convince our colleagues and the patients that we encounter to spread this to
Mhm.
their families and friends and orgs. And I actually have an author who has done a lot of work in the Black community with writing books and things, and I'm definitely going to share this with her.
Oh, yeah, that's amazing. Thank you. I really appreciate
Mhm.
you saying that. I completely agree with you. I think this is a phenomenal study to be able to understand disparities, but also it's like once we get all this data, what are we going to do with it? We're going to use that to really understand how can we implement the right solutions to try to, really reduce the number of cases that we're seeing and the disparities that's causing Black women to be able to have a poorer prognosis,
Yeah.
Hmm.
with the diagnosis. So any and every support we can get from partners, sharing the word and really just increasing that enrollment. I know Karen kind of referenced where we're at with recruitment and the total number that are enrolled. And of course, the more we hear from the voices of Black women, literally that's really going to be what helps us use that data and get the
Hmm.
solutions that we're hopefully wanting to seek out.
Yeah, yeah. On the back end, this is going to be the research collection of data that keeps giving. So I see many, many, many publications coming out of this and informing
Yeah.
everyone about a population that hasn't been talked about nearly enough.
Hmm.
Claire, did you have a question?
Hi, Hi, I'm Claire Tessman. I'm a nurse practitioner in a disability lifespan clinic here at UIC, and I work with a lot of people with diagnosed neurodivergence of various kinds, and I would love to expand this in that area. Is there any guideline about eligibility concerning mild to moderate intellectual disability, folks that can read and have consent capacity? Can they still participate?
Yeah, so from my understanding, and Karen, of course, correct me or add on, but I know that eligibility is really just having no previous cancer diagnosis. If there is any other specific health history or medical condition, that does not stop them as long as they're not previously diagnosed with cancer. Of course, in
Great.
that life and health history survey I did go over, we will be collecting information on what, if any, underlying conditions they do currently have.
Great. Thank
Yeah,
you. That's great.
Yeah,
yeah.
and oh,
If
sorry,
I can
go
just,
ahead.
no, sorry, I just wanted to ask a clarifying question. So Claire, were you saying that these individuals would not be able to give informed consent, or they would be able to give informed
No,
consent?
that people that have consent capacity completely.
Oh,
Yeah.
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 Yes,
Yeah. Yeah.
absolutely. Yes, they are able to participate.
Thanks.
Great. Yeah, another population, speaking of kind of populations to talk about, any restrictions on folks who are at elevated cancer risk, breast cancer risk, or previvors with genetic mutations?
No, there aren't any restrictions with that. That information is also collected in the life health history survey. So if they're not diagnosed with it, but let's just say they have a direct parent or a relative that is diagnosed with it, then that it increases their risk. We'll collect all the risk factors as well, the family history. Um, so all that would be collected, but we would just want to follow them twice a year. But that would not stop them from being a participant.
Mm-hmm. Okay, great. Yeah, Insia commented, I know you're working with Miles Square to push this out too, but also the family med and primary care, family med being a lot also at University Village in Pilsen. I would highly recommend trying to talk with those folks as well. If you need any contacts, Gargi, I'm happy as I work at University Village for
Mm-hmm.
UV and no, Sean, calling you out. How do you think Pilsen would be able to use this? Oh, I thought he was on here. Maybe he's having trouble unmuting. One of our team members, oh, he did hop
I,
up.
I really wonder about PCC and Austin. Like that seems like
Hmm.
those West Side clinics would be a good place to go.
Yeah, and we have Miles Square. I mean, if you're doing Miles Square, all the Miles Squares, like South Shore, Inglewood, it's going to be very, large populations you can tap with there. Kristen, calling you out because is there a way we can communicate this with IBCCP women? Maybe she's on the phone with the patient. Kristen is part of our survivorship team, Kristen Anderson. I might put you in touch because she does a lot of work with the Illinois Breast Cancer and Breast and Cervical Cancer Program with getting underrepresented folks their screenings.
Mm-hmm.
It might be a great population to try to propagate this information to. Yeah, Karen, definitely. I should get you guys in touch. It is very likely she's on with a patient right now. She's works tirelessly for us.
Mm-hmm.
Um, and yeah, just trying to think of populations that you can work with and how to spread this out. Anyone else on the call have any other questions or suggestions or something you've done in the past in your research or in community engagement that may help out Gargi and Karen? Speak up, unmute. Tamara, do you have any tips for this? Or Tarnika? I'm trying to get you.
I would say I actually signed up for the study, and I've done one or two of the side studies, the sub studies. And so I know Gargi said like there is no incentive for participating, but I have gotten small gift cards for doing the sub study. So
Oh, cool.
I think that would help.
Yeah. Yeah, I think that's a good perspective. Thanks, Tarnika. Um, so yeah, I think a little incentive, something, even like a $5 Starbucks gift card or something like that, it would be a great way to help engage folks. But yeah, how do you target where do you send that out and things?
Mm-hmm.
I know you're working with the UI Cancer Center. Are you also working with the other centers, Northwestern Rush, U Chicago, and that?
Yeah, so our internal structure, with my role being Associate Director of Community Partnerships, it's me and my counterpart in Illinois, where we work with community-based organizations and federally qualified health centers. So we're leveraging our local partnerships there. We have an Associate Director of State Partnership who actually works with,
Great.
agencies such as IPCCP,
Oh, great.
IPHA. A lot of state level partnerships and health plan partnerships are driven through our colleague there. And then I know Karen is our Associate Director of Cancer Center. And then we have, I believe, three other Associate Director of Cancer Center. So we're all working as a team in Illinois. And then a similar structure across the US where we have those partnerships. So I think Northwestern, we do have that partnership, Rush University. Karen, feel free to speak on, some of the cancer centers you're working with, but I do know that we are reaching different health system partners that we have here locally.
Yeah, that's correct, Gargi. Yeah, so in terms of the other healthcare systems, I'm having conversations and active conversations to see where folks are willing or able to share the message. So we have had some healthcare systems maybe posted on their website. I'm also having discussions with some of our research leaning institutions, including UIC. See, can voices be added on even like a research engagement platform? So even with the University of Chicago, not, I'm sorry, University of Michigan, their research engagement platform, we've actually seen some success where people come to the platform. They're looking for areas in which they can engage in different research projects. And there's a page specifically on voices. And so we've seen some enrollments through there. And so that's something that we're trying to see if we can bring to Illinois and see some success. We're also exploring the idea of emails and letters to constituents or patients, letting them know about their about the study, their eligibility to enroll, of course, with all of the proper language. That information is not going to be shared with the healthcare system, but that's something that we're also exploring to see, our partners who have these direct links to the eligible population, how else can we help get the word out? And so we're having those discussions right now.
Betty, you have an idea?
Yeah, it's about getting the word out and there not being an incentive. If you can produce media to share, to add to the language what this incentive could be, this is to empower understanding of what, you got to sell it because this is going to take a lot of time and they're not getting paid for that time. So, and hopefully there's that, what is it, the altruistic feeling that they want to give back and be a part of this. So please generate some communication on that. I'm looking through the slides that are available and I don't see any. There could be something out there already on that. I'm just not seeing it. But it's really valuable if you're asking somebody to give so much that they understand why they are being asked to give so much and how their input as a stakeholder will benefit the greater population of humans.
Right. And
Yeah, you're absolutely right.
it won't just benefit this population too, as I'm thinking of as this study, comes to fruition and all this information is being put out there. Like, who knows what studies can be modeled after it for any population, Asian
Yeah.
population, Hispanic population. I mean, it's going to kind of keep snowballing. So I'm really glad you guys have set up this thing.
Yeah, one of the things that we're seeing is that, yes, we are in media, or you might see us on a lot of the news channels sharing the message. But Betty, you're absolutely right in that we're asking these women to share a lot of their personal information.
Mhm.
And not only that, we're asking them to share this over several years. And so the fact that we do not offer an initial incentive for enrollment, sometimes that can be a barrier, especially for
Yeah.
women who are used to participating in some of these other studies. And so, where we are finding that we need to lean in more is that it's maybe multiple conversations with women. Sometimes it's within a space in which, again, they're hearing from trusted voices, but they have the opportunity to ask questions. They have the opportunity to have more of a robust discussion about what's happening with the health of Black women in this country, why we've been ignored for so long, and how this can really help turn the tide with what it's been, right? We're dealing with a lot of historical factors, a lot of historical trust issues. There's a lot of those different barriers that we need to
Mm.
get over. But what we find is it's important that we continue to um, raise this up, right? So getting it out there so people are hearing about it, and there's multiple touch points in which they're hearing about it. But then also, if we can have an environment where there's just a space for women to ask questions, really kind of get it out, then we would see more success. So we're playing this on a lot of different levels. There's a lot of different multiple strategies going in, hopefully with the end goal of more women going to be enrolling into this.
Yeah, because it's not just about African American women, African Americans being, historically under-researched. It's all women too.
Hmm.
It's a double threat because women were not even included in clinical studies for the most part until the 1990s. 1990s, guys, that was less than 40 years ago. So when you think about that, what would we really know about women,
Hmm.
Yeah.
period? And on top of that, a disenfranchised population. So
Absolutely.
very important work. Okay.
And with the uptick in colorectal cancers, in younger people, right? I hear so often, oh, but it's too hard to study what they ate, which in this day and age, it is not. We have
No.
Visa receipts that document, I mean, right? If
Yeah.
you have an app to your grocery store, if you're
Yeah.
fortunate enough to have a grocery store, right, in your community, it tracks every single thing you buy.
Mhm.
So I love the alcohol, tobacco, the diet, physical,
Yeah.
you are
Mhm.
collecting so much information here.
The important things for sure.
Yeah, I think at this point we definitely have more access than we did even before to be able to collect this information. Just as an individual, like you said, we have receipts, we have more information, more like the way we use technology, there's more accessibility to even track some of this information now. So it's the best time to be able to monitor and track and ask individuals with younger individuals getting more easily diagnosed, right? To that point, it's we actually have more info now at our hands and fingertips than we did before to be able to understand why are younger individuals getting diagnosed more.
Speaking of all those younger populations, what is your social media reach? What platforms are you on, and how much have you leveraged that?
Yeah, so our social media, we are on Facebook, Instagram, Twitter, which I guess is called X now, and then LinkedIn.
I
Um,
would
those are our four main national platforms that we're using.
I would get on TikTok and Reddit.
And I'm clicking on those links from the study's website, and it goes to the general ACS platform. I would encourage you if possible, to develop your own platform on all of these for this study.
Yeah, I have
Or,
more.
come up with a hashtag that everybody can use
Right.
to, yeah.
Yeah. Yeah, the younger population especially, you'll find a lot more on Reddit and TikTok.
Mhm.
And, I've been told by multiple people on certain about certain conversations. So like, wow, you would blow up on TikTok.
Yeah.
So find a TikToker in the ACS. And I don't know how to use it either. So I'm past that generation. But are you also leveraging like community organization partnerships? What
Mhm.
orgs are you involved with?
Yeah, so recently so there's a lot of local partnerships in Chicago. We work with Equal Hope. Immerman Angels is one that we recently connected with. A lot of local faith-based partnerships as well. Advocate for Community Wellness. So there's a lot of CBOs that we work with, and then we're always expanding, working with them even closer as we get connected through them through other events.
One I would consider is Force, FORC. I don't know if you've talked to them or Bright Pink because they're pre-vivor organizations and
Oh, okay.
probably have a large group of African American women. Um, so mostly hereditary cancer, but those may be they're very large networks to
Yeah, you said fork, like FORC?
FORCE,
Oh, sports.
force
Okay.
facing our risk of cancer empowered. And bright pink is, I think it's more local, Chicago based.
Okay.
Um,
Yeah, we can connect. I'll look them up for sure, especially with them focusing on the pre-vivers. I think that's a really good opportunity to be able to
mhm,
connect with them. I know my colleague also works with Pink Divas and Sisters Working It Out. So there's a lot of local partnerships going on, but
mhm,
there's always so many. So that's where we love
yeah,
being able to
right.
work with our partners like you all. And if you work with others, community or connecting, making that connection and us I can research them online and be like, wow, this is perfect. And getting that voice out there this is exactly, one of our biggest things that we look for when we're talking about the Voices campaign is sharing it with partners because that network that our partners have is
Mhm.
also just as substantial.
Yeah. Yeah. And it's hard, I'm sure. Like there are certain groups that they're great groups, and I would suggest like Wellness House was all folks with cancer
Hmm.
who go there. But yeah, there's a fair amount of previvors also at interveners, like you said. Have you approached CPS, local school
Yeah.
councils, parent organizations, flyers in the libraries? In museums or I don't know, whatever you're allowed to put stuff up in.
Hmm.
So I would say yes, we have shared a lot of that. I know maybe last year or so, I had some tabling in the Chicago public libraries. But when we look at where we get enrollment from, they're not coming from those areas where people are seeing a flyer. And so we know, yes, it's good that there's a touch point. It brings more awareness in the community, but
Right.
it's not necessarily driving people to enroll. I
Yeah.
think without them being able to have a space for that deeper conversation or
Yeah.
deeper understanding of why they should enroll, especially with no incentive. So, again, we're really trying to go the route of where there's trusted voices or trusted institutions helping to spread the word about this and
Hmm.
bring and creating that space for conversation as needed for them to be able to finally decide to, okay, I'm going to do it. I'm going to sit down and do it and
Yeah.
start the enrollment process. But great question, great points.
Yeah, I think that the warm handoff is, like you say, Karen, very important. And sometimes people need to see things a few times. They need to see it
Hmm.
on Facebook and in a flyer and, hear from their doctor to actually make that jump and do that. So,
Absolutely. Yeah. So after traditional media, the next, like when we rank, like how are people hearing about voices and they give us that information when they're signing up, the next one is through either a friend, a family member, or an ambassador. It's someone just reaching out to them and text, say, hey, did you hear about this? I signed up. Maybe you should too. That's or they're having those conversations with them. And then also social media. Again, if we have people who have that audience, they're trusted individuals, they're willing to, talk about the study or, tell people where they can go to enroll, that also helps.
right. Yeah, Insia brought up with those hospital networks you're involved with, if there's any way to reach large groups of populations through like a My Chart blast with a message from
Yes,
your
that
doctor.
absolutely. That's where we're hoping to have those conversations with our hospital partners to see if they would be willing to just, yeah, send it out to the eligible population through MyChart, or
Right.
even, some of them have, the television streams while people are in the waiting room. So we have video messaging and clips that can run on a loop. So
Hmm.
absolutely great ideas.
And there's
Hi,
a, oh, sorry, go ahead. Who is
I
talking?
just wanted to, hi, I'm Andrew.
Yeah, hey, Andrew.
I've done some recruitment at UIC, but at least for the cancer clinic there, I think this is recent, but you can't recruit through my chart.
Mm,
Mm,
I think
really?
that was recent. I think maybe double check that, but just so you know,
Hmm.
I might have misread that, but
Yeah,
I
you
got an
might
email
need to
saying you
get
can't.
extra permissions, right?
Yeah,
Hmm.
maybe. Yeah, but
Yeah.
maybe if a study of this magnitude that make an exception. Not sure, but
So
Yeah.
one
We
thought,
discussed that with Mile Square a little bit, to kind of expand
yeah,
that to reach through EMR. But I know to your point, Andrew, sorry, at first I thought I heard you say that you can, but you said you can, so it's not awesome. But the MyChart blast, we were thinking about it, like being able to leverage the EMR, but I know that there were some loopholes through that. So that's something we're hoping to expand in the future when it's more possible. But I think there were some like obstacles we would face to be able to, push that out to the eligible population through the EMR.
yeah, and she also suggested waiting rooms, which hanging a flyer in a waiting room so that patients are looking at it and asking their doctor about it would be good. I have another side project, call it that, if you will. And we actually, this might be we're talking about a lot of hospital engagement and opt into engagement with community orgs, et cetera. We're discussing eliciting salons and
Mm.
stylists. So that may be another way to communicate with those African American women because they're going to get their hair done.
Yeah. I think that is a really smart way. And that's where we see that, we work with community-based work, and that's where our ambassadors are really helpful too, right? Because
Yeah,
we're really not limited in where we can get this study reached for the population, right? Like it's not like it's just health systems or it's just an organization that works. It's truly anybody and anyone that can help us, like libraries, like you said, salons, like you said, grocery stores. Like it's really anywhere and
right.
everywhere to be able to reach the population,
Yeah,
to know that this study exists and your voice can be heard by just sh filling out a survey and twice a year being able to be reached by email to update that survey. So it's a
yeah,
low lift as well. But again, that's where it comes down to being able to make sure we're also sharing the why for why this is important
right.
for you to participate is also just as key.
Yeah, yeah, you got to compel individuals to complete it. So yeah. Karen and Gargee, are either of you on the Cancer Survivorship Provider Network, CSPN? Um, there have been a few on here. I don't know. Karen might still be on. Um, but I invited all of them. It's a network of, it might be up to a couple thousand by now. Um, People invested in cancer prevention, cancer survivorship.
That
I
was
don't
that
think I am. Or is that
Michelle?
Cancer Survivorship Provider Network. Look up the CSPN.
I've heard of that through a contact from the Aon organization. I don't know if I'm thinking of the same thing though.
It's kind of a Facebook for folks in cancer survivorship. Is that pretty accurate, Betty? Yeah, it's cspn.org. Thank you, Betty. Put the link in the chat. Thank you. Yeah, they are a engaged group of individuals who are all invested in things like this. So it may be another good group to engage. Um, so yeah,
Yeah,
I
thank you
know
for dropping the link.
we're running out the hour here, and I guess people are getting an insight into networking 101 and how to push out research studies. Um, if no one else has any other comments, we'll wrap it up here, but we should stay in touch. If I think of any other ways or, we can collaborate in any way to, help push this forward. Dr. Ganshaw was sorry she couldn't be here this morning, but everyone, there will be a recording of this talk, hopefully within the next week up on our YouTube site for the Cancer Center. So, oh, Victoria, what do you got?
I'm sorry, I was just sitting here and doing some with my volunteer at the same time. But I heard all the places that they suggested, even with the salons and that. And then I was thinking, what about the Black Women Expo that always come? It's a huge thing that goes on at the McCormick, and there is thousands of
Yeah,
women show up from all over at that location. Even if
Great.
they can get like a vendor table or something
yep.
set there at
Yeah,
the
we've
Black
done
Women's
that.
Expo would be a good idea.
Yeah,
Yeah, we've had that. We did table as a vendor last year, and I can't remember if we did it the first year. I think that the study was released in 2024, so I know for sure last year we did have a couple of days where we did table, and we specifically did share the voices of Black women study there.
Oh, okay, perfect. All right.
do you guys also table at ASCO?
We have a larger national presence at ASCO, so a lot of our national teams, our Chief Patient Officer, Dr. Kamal, who leads the patient support
Great.
department, they all do have that presence and they all are attending.
Great. Yeah, but having like a specific voices booth or
Hmm.
section would be a good idea there too to get that word out nationally as well. Oh, the Bud Billiken Parade. Thank you, Tarnika. I forgot about that too on the south side. Heavily attended. House music picnic. We can go on all day. So, if you have additional ideas for networking or building this program, um, that then definitely email. You can email me, email Gargee or Karen directly. We should all put our emails in the chat right now. Oh, I, mine isn't set up. I think you know mine. The things are coming from. Oh, we got another comment though from Adrian. People are getting in it now. Adrian, did you
Hi,
have
how you
some?
doing? I'm the new director for the cancer clinic here at UI Health. I haven't heard anything specifically about not being able to recruit via my chart. I can look into that. We have our clinical trials office that works out of here every day. We also do have area where a table could be set up if recruitment is a priority. I think it's usually utilized by Wellness House, who comes in and talks to patients about events, upcoming events. And I think Wellness House may also be another opportunity to network because they are hosting lots of cancer related events specifically for those who may not have access to these things throughout the community. And so that
Mhm.
this may be also a place to connect with as well. But ultimately, I think, I can look into the my chart and potentially follow up.
Perfect. Yeah, that would be wonderful if we
Yes,
can
thank
share
you.
emails in the chat for Karen and myself. And then I don't know if the EMR and like the my chart would be the same for mile square population, but if it is, then I think that would be really great as we kind of work on next steps with our partnership with Mile Square as well, now that it was approved by the Board of Research Council to
Mhm.
disseminate and share.
Remind me, are you guys on Epic?
Yeah.
Okay.
Yeah, we are. Also engaging just the primary care clinic, the
Mhm.
PCC and the OCC, because they have another myriad patients there as well.
Absolutely. Yeah, if you have a contact for the primary care clinics, I would definitely be interested in connecting with them, not just for voices, but in terms of all of our prevention and training and educational resources. I want to make sure that I have a connection there. So,
Yeah, our connection into primary care is Dr. Neha Awati. Do you know
okay,
Neha, Karen?
don't think so.
Yeah, feel free to reach out to Dr. Awati. You could CC me. Um, I'm sure she'd be happy and she might know more about that because she is a physician. I am physician in primary care, also in survivorship and prevention. So she would have more tabs on who to speak to there.
Is that AWATI?
TI.
Would you mind popping in her
Oh yeah,
email address?
yeah. I won't. I don't know why. MOT. Higher. I'm not sure that is 5, so I'm just gonna put her name and it will come up. Um, yes, thank you, everyone. And yeah, I was thinking about Adrian's comment about the Wellness House. Even I know it's a lot of cancer survivors who are ineligible for the study, but a lot of them bring caregivers or
Hmm.
have family members that can participate. And
Hmm.
if you can communicate with them, they're likely
Yeah.
to communicate with their family and their caregiver. So that does open the door for all those cancer orgs.
Yeah.
Like Gilda's Club, or even
Mhm.
more of advocates for community
Hmm.
wellness and Wellness House. Anyway, we've had a great brainstorming sesh. Thank you to everyone still sticking around to listen to us talk about the network in Chicago. It is great. It is large. It is tricky to leverage. But we all are in this and want to help with this initiative. So thank you for speaking on this study, Gargee, and thanks for all your work, Karen. And thanks for all the great comments, everyone. Enjoy the rest of your Thursday and your weekend.
Thank you all so much. Have a great rest of your day.
I put Dr. Awadi's email address in the comment. It's
Oh, it's
awadi1 at
one. I almost put
UIC.edu.
5. I think, Adriana, that's yours at E5. Or no, Genesis. Anyway, someone was 5, so thank you for doing that, Victoria,
Thank
and
you.
confirming it.
You're welcome.
Thank
Okay.
Thank you. Bye
Bye.
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 Thank you.